other way around.
Thank you for that introduction. I'm going to share my screen real quick and make sure that that all goes according to plan. Do you all see a PowerPoint presentation? Thumbs up, anyone? Okay, good. Yeah. I can see about 5 of your videos, so as we go through, if there's questions, I'm happy to answer them in the moment, but I do intend to finish with time at the end so we can have conversation too. So I'm glad to be here today and to have an opportunity to share a little bit about where we are with diversity, equity, and inclusion in the department, and talk a little bit about some data to support where we are, and some action items or plans for moving forward. I think as we all know, it's an ongoing process to continually address areas of DEI in all aspects of our professional work, and hope that this continues to be a place where we can have conversation around this too. I don't have any disclosures. I have no financial components that I benefit from. I will say that we all have much to benefit from including diversity, equity, inclusion in our work, but I don't have any benefits that I get from this financially today. As I have started including in our presentations, and I'm grateful for folks who have included it as well, this is our formal land acknowledgement that was drafted through the University of New Mexico. I'll give you a second to read this. I have a second slide that is going to take us on a slightly deeper level of thinking about acknowledgement as well. So this is a slightly different approach looking at acknowledgements as well. This one came through Brenda Pereira. Some of you may have known her in her DEI work with the School of Medicine, as well as Diana Martinez, the director of our Leo office, and her mother, Professor Montoya, with the UNM Law. And why I want to have this on here is I also think it's important to introduce different ways of thinking about acknowledgement. Of course, we have the land acknowledgement where we are going to recognize where I am and where many of you are today with regards to being on Pueblo, Apache, and Navajo lands in New Mexico. And that's an important component for us to consider on any presentation that we might do, even if you're doing a conference presentation in Oregon or Montana or in Texas, how important it is to publicly state the land on which you might be presenting on. Another way of encouraging acknowledgement is also looking at beyond the land. And so this picture here is an opportunity for us to then reflect on our ancestors. This is intended to bring our minds to reflecting on and acknowledging the shoulders on who we stand, recognizing the doors that may have been opened for us by others. In particular, this image is there to invite acknowledgement of freedom fighters and those who fight to open doors for us. And recognizing that some of us have had those doors open and not all of us have had those doors opened for us. Another opportunity to also acknowledge missing voices, those who may have been deported, departed, detained, displaced, very relevant to what we're seeing happening in Afghanistan today. That some of these opportunities that we are privileged to are just not accessible. Doors aren't opened for those individuals. And recognizing the value that the voices of those who do come through those doors, how much they bring to our systems and our understanding of the work that we do. And another piece that many folks have started to touch on as well in acknowledgement is this aspect of time oppression. You all are busy, we are all busy, we are scheduled to the max. And it's an opportunity to acknowledge that you all are doing that work. And an opportunity to acknowledge that we also need to value wellness and having space to be time for ourselves and to be with others as well. And it's an opportunity to just express that I and we value you. So opportunity there. So what are we going to do today? This is what I hope to do. I always feel like hesitant with these objectives because I wonder if I were ever to be quizzed, if I would actually formally be able to answer all of these objectives. So I hope that I do a good enough job today to be able to help you have at least an initial ability to describe our department faculty demographics. And I'll touch on why it's just faculty in just a moment. That you have an opportunity to discuss or be able to start a discussion following today about our aspects of DEI and how we're doing in the department, and then be able to identify our current priorities based on the survey and efforts that we might make with regards to diversity, equity, inclusion moving forward. Just a little piece of here about how do we make diversity, equity, inclusion a priority. I think many of you or some of you might have been at the rounds that I did at some point in the last year, which really focused on the individual, what it is that we can do to consider our where we are with regards to being prepared for change and considering how we are doing with regards to diversity, equity, and inclusion. And so today's talk is going to be a little bit more at a systemic level, but the importance of how we do our work in making change, it needs to be embedded in every systemic layer of the department, and the importance of resource allocation in order for this to be done. And resource does not necessarily mean money. It can mean time and space and an audience in order for different voices and perspectives to be shared. One approach that we have been kind of bouncing around in thinking through the HSC system as a whole and how we might look at infusing, in particular, DEI into recruitment and retention efforts is considering our system as an ecosystem and understanding the relationship and the interrelationship between each level of those systems and how in order to be healthy, we need to have the DEI efforts and priorities embedded within each level of those systems. And in each level of those systems, we all might have some spheres of influence with regards to making that happen. So here's just an example of what that could look like if we think of the sociological approach of our system. So when we look at ourselves, we're down here in the middle of the individual, how important it is for us to look at our own knowledge and what we know and don't know, being aware of what's happening in the world and what's happening in areas where we might not have as much experience, our attitudes, our biases, and our beliefs. The level that would wrap around that would be you all as my co-workers and colleagues, family, friends, individuals that you might encounter on a regular basis. Then we have the organizational and institutional level, which is going to look a little bit about where our department might be, as sort of an organizational systemic level, but also thinks of the systems within UNM, of which there are many. We've got the School of Medicine, we have the HSC, we have the UNM umbrella over all of us. Our institution and we all exist within a community. The work that we do is transactional with our community. And so the work that we do to infuse DEI into our institution can't be done without consideration of the community. And our community exists within this larger societal context that can be smaller in the sense of New Mexico, but certainly larger in the context of things that happen nationally or perhaps even internationally that would impact our knowledge and awareness and need to make change within our system. So today, I would argue that what we're mostly looking at is this organizational level, is how do we consider things from the systems of our department more specifically. So what we're going to start with first is just some basic information about our department demographics. We're doing this HSC wide, and so there is a HSC place within our what's called the Office of Institutional Analytics, OIA for short, where you can actually go and see through kind of a Tableau like mechanism data about the larger College of Nursing, College of Pharmacy, College of Population Health, and the School of Medicine. This data that we're going to look at today and that we're working for across the whole HSC system is more specific within School of Medicine with departments and divisions. We have staff data and we're pulling it together, and understanding the staff picture is incredibly vital. And so at a future time, I'll be able to come back and present on the aspects of staff. So the data that I'm presenting from the faculty perspective is coming from the Office of Institutional Analytics. They pull that information from the banner system on MyUNM. So this is all self-reported. A little plug that if you have not been into MyUNM anytime recently, it is important to go in and check to make sure that what you have checked off is what you want to be checked off. And if there's things that are blank, to fill them in if you're comfortable with that. One of the areas that most people will have blank is gender identity and gender pronouns. That was a recent addition to MyUNM within the last couple of years. And so if you have an interest in reporting that, that would allow us to eventually be able to look at data beyond just male and female, depending on the numbers and that we might see within the system. There's also the capacity to look at veteran and disability status. I am not reporting that data today. I'm still trying to get a better understanding of that, but the tricky part with the voluntariness of the data is if somebody does not select that they're veteran, it doesn't imply that they're not a veteran. It just implies that they perhaps didn't want to share that. And the same goes with disability status. So it's a little bit, there's risk, I think, in misinterpreting that data. But there is the capacity to look at veteran and disability within the faculty and staff demographics. So this first slide gives you a picture of faculty within our Department of Psychiatry and Behavioral Sciences. Just to orient you to the slide, we have bars that are going to represent the years 2016 to 2019. 2020 is available and 2021 will shortly be available in November. And since we've spent a large part of this year really getting 4 years of data and we're a little bit behind on the recent numbers. The goal of this in the long term is to be able to see some trends where things might be staying the same and where things might be going up, going down, and an opportunity to have some baseline data in looking at if some sort of systemic intervention is developed and enacted, does that create some change in our trends with regards to faculty demographic data? So here, if we look at 2019, you'll see that we are 35% of male in our faculty, about 34%, 64% female, 67% white, 6.38% Asian, 0% African American, 0% American Indian, 15.96% Hispanic, 0% Native Hawaiian, 6.38% two or more races, 1% unknown, and this in our system is known as non-resident, and I've titled it international, so it's 3.19. So I think that the reason why it's important to see this data is for tracking. I think sometimes it's an important piece to then recognize the self-report nature of demographics, and I think if we look at the census and information that we are seeing about the two or more and multiracial categories, the importance of this category and how our system captures that will be important over time. You can see that we are missing faculty in certain demographic groups. This is another way to look at the data, just without the bars, to make it a little bit more evident of where one group stands with regards to the other, and any trending up or trending down. It's not a statistical analysis of a trend. It's clearly just a way of mapping the bars in another visual way. You can see that we have females above males and the lines are relatively flat. A same way of looking at it with race and ethnicity. You can see that our white faculty, white, Caucasian, European American is up at the top, followed by Hispanic, next with Asian, and then the rest of the lines below that. So visually it allows to be more evident of the gaps that might be evident in demographics. Next is a series of slides that will compare our faculty to other groups in some way. And there's lots of talk around benchmarking and how do you compare, what is the goal? What is the number that we're looking at? And the reality is we're not looking for any number. The reality is we're looking for diversity, equity, and inclusion, but that this is a proxy for us to be able to see how we're doing in certain ways compared to other people. So compared to the census data in 2019, you can see that here we have psychiatry in yellow. We have our US demographics in blue. So compared to the US, our faculty is less male, more female, about the same white, slightly more Asian. We are missing Black and American Indian in large numbers and doing better, but still not quite comparable with regards to Hispanic. And doing better in the area of 2 or more races. I think that many of us will see these numbers shift based on the new demographics data from the 2020 census. Compared to New Mexico, we are the university for New Mexico, and being able to have a workforce, whether that's faculty, staff, or learners that are representative of our communities is important. And so it's important to look at that community level of our system and how we compare demographically. So we got New Mexico in blue and psychiatry in yellow. We are less male, more female, slightly less white, more Asian, still missing the Black and American Indian. And then of course, compared to New Mexico's higher numbers of Hispanic and Latino, behind with regards to that demographic as well. Native Hawaiian, none, and that's the same as what it is in the demographics of New Mexico, and slightly better with regards to 2 or more races, slightly more numbers, I should say. So that's just a snapshot of our faculty data. My goal again is to have this for staff. There is the capacity to have it for learners and residents. That data is kept in a different data set. And so I'll have to reach out in a different way to get access to it. There is a report that we have, and eventually I'm sure Dr. Tone and I will talk through how that is best to be disseminated to department in some way to be useful for everybody. So next I'm going to switch gears and move into looking at our survey specifically. Many of you probably saw this go out I think it was the end of last year, that we really started to disseminate the survey, and it was in the newsletter and it went out to various emails. The goal for this was to create some sort of baseline understanding really of climate, I think is probably the biggest term with regards to diversity, equity, inclusion. Use this data to inform action planning and guidance for leadership on where would the areas be of interest and where you all in the department might have some momentum with regards to what we should do with regards to DEI in various ways. And the recommendation is this is not just a one-time survey. Many climate surveys are done usually larger spans of time, 7 to 10 years. And so thinking of how we can encourage some similarity between surveys so that we can track things over time. And so we had 105 respondents who started the survey. Not everybody finished it, not everybody completed every item. We had 62 respondents that completed the survey in full and 43 that partially completed. I did not pull out data if it was not complete. So if some questions might have 105 and some questions there might only be 62 or 43. It's going to be variation. I think it was important to capture whatever data folks were willing to share, regardless of whether or not they completed the survey in full. When you look at the demographics of our survey completers, we had, this is numbers, not percentages. We had 55 faculty complete it. We had 37 staff members complete it and 13 learners who could have been a resident, a fellow, or an intern. When we look at how long folks had been with the department, we had 34 who had been with the department for more than 10 years, 45 less than 5 years, and 5 to 10 years for 26 individuals. In the reports that have been draft reports, this data in the that we'll go over today has been broken down in a lot of different ways to create comparisons. And so there is a way, if we need to in the future, to look at faculty and staff and learners that might come in different sort of department generational years to compare data as well. The majority of our respondents identified as white or Caucasian. Next would be Hispanic or Latino, some folks who preferred not to say, and then the multiracial, biracial category. We had a larger proportion of females to males that completed the survey. I did get feedback in a way that we'll rewrite this. This is a very dichotomous way that the survey was written. And so I want to acknowledge that this question could have been done better to capture less dichotomy and more fluidity with regards to gender identity. So the next batch of questions, we'll look at climate. So what happened with these questions on the survey? There were 2 words that were on a sliding scale. The survey was done in REDCap. And so one word, for example, inequitable might have been on the 0 side, and equitable would have been on the 100 side. And the participant would move the slider to say, rather than a likely or you agree or disagree in a sort of Likert scale, it created a number. So if you were right in the middle, it would have been 50%. If you were saying that something was incredibly equitable, it would be 100%, 100. And then if you were saying that it was completely inequitable, it would be a 0. So this is data that looks at a comparison of faculty, learners, and staff. So we, on this graph, have our learners in blue. We have our faculty in orange, and we have our staff in gray, at least on my screen. The categories that were on the options of looking at climate were inequitable or inequitable, insincere, sincere, unsupportive, supportive, lacking representation or representative, unwelcoming or welcoming, disrespectful, respectful, non-innovative or innovative, passive or active, and racist or anti-racist. There are all kinds of different things we could have put in here for climate. These were the ones that we landed on for this survey. And I think that we need to put thought into what we would more accurately want to capture for future surveys as well. So if we look at this, we can see that by and large, the faculty are rating the higher level within the sliding scale, which would err more towards the words that you might see on the right here. So for example, our faculty rated on average 74 for the department climate being equitable. Our learners were seeing that at a lower amount as being 65 on their average rating. And the staff were seeing that in between us, faculty and learners. So by and large, the faculty are seeing things in a perhaps more favorable light if we assume that being equitable, sincere, supportive, and welcoming would be the more positive, favorable direction. There are some areas where things are a little bit more even compared to our faculty, staff, and learners, and some things that are a little bit more bigger gaps. So for example, our learners are seeing us more passive with regards to climate and DEI than the faculty and staff are. The next comparison is the best proxy I could think of given the numbers, rather than looking specifically at racial and ethnic groups and comparing them to each other. A forced dichotomy of white versus non-white. It's not ideal, but it gives us at least some capacity to look at how we might compare between a sort of underrepresented group and a more representative group. And so we have the white Caucasian identified from the survey in blue, and then we have the non-white, non-Caucasian represented in orange. And these are, they're fairly similar in regards to closeness within the bars. Our white Caucasian completers of the survey are seeing things slightly more favorable in many domains than our non-white, but it's not without sort of doing an actual error or a statistical piece. I guess I can't accurately say that, but it's a small margin of difference between the two groups. It becomes a little bit of a different picture when we look at male versus female. And this is, I think, a little bit of a trend throughout a lot of the charts, that the discrepancy is a little bit larger when we compare a male respondent to a female respondent. So here we have males represented in blue, and we have females represented in orange. And for the most part, respondents who were male were seeing the climate with regards to these specific categories in a slightly more favorable way than our female colleagues were. There's a lot of qualitative pieces in the data. I also looked at these from medians instead of average. There was a very large scale difference from 0 to 100. And so the report will definitely dive into this in a much deeper way. The qualitative stuff is obviously a lot more identifying, and so that's not going to be reported today, but will be looked at in order to explore for general themes among respondents to inform the data as well moving forward. So this question that we have here is looking at the question on the survey related to microaggressions. And so the question is, how often were you experiencing microaggressions from someone within the Department of Psychiatry and Behavioral Sciences? The options were never, daily, weekly, monthly, or once or twice a year. I have this in two charts. So this first chart is numbers, but of course we had a lot more faculty than learners respond on the survey, so it looks a little bit more distorted. The next chart will show percentages. So you can see the percentage of faculty, the percentage of learners, or the percentage of staff who responded. That makes it, I think, a little bit more of an equitable comparison. But based on this, we have, looking at the positive thing is that nobody was saying that daily they were experiencing microaggressions. I think that's always good to consider aspects of the data. Again, this is self-report and what folks are reporting, and doesn't capture all the voices, and some individuals may have chosen not to complete the survey. Weekly, we have a little bit more. Monthly, we're starting to creep up. Once or twice a year, folks are experiencing it, especially with faculty, and a large portion saying that they have never experienced a microaggression from someone within the Department of Behavioral Science, Psychiatry and Behavioral Sciences. On the survey, there was a definition. There was a little video by Daryl Wing-Soo to help ground people in what we were helping folks answer the question from a similar point of understanding what a microaggression might be. This is the same comparison, faculty, learners, and staff, but is now looking at percentages. So the percentage of those faculty members who completed the survey, how much were they reporting a microaggression within the Department of Psychiatry and Behavioral Sciences? So if we look at faculty, 35% are saying that once or twice a year, they are experiencing a microaggression. Our staff are higher, that 40% are experiencing a microaggression once or twice a year, and learners would be 36%. And it goes through the same for monthly, weekly, daily, in never. So our learners are experiencing monthly, 18% are saying they're experiencing a microaggression. Our staff are saying weekly, 10% of them who completed this survey are experiencing a microaggression. The next is the same comparison, looking at the forced dichotomy of white versus non-white, Caucasian versus non-Caucasian. So we see here the numbers and frequency with regards to number of individuals who are reporting a microaggression within the Department of Psychiatry and Behavioral Sciences. I'll use this one for us to look at today. Compared to our non-white colleagues, our white colleagues are experiencing 42% of microaggressions once or twice a year. Our non-white colleagues are experiencing 27% are experiencing a monthly microaggression. 9% of our non-white colleagues compared to 4% are experiencing weekly microaggressions. A way that as each time I go through this data, I keep thinking, I think given this sort of differences between male and female, another way that this data will have to be looked at is perhaps our male and female colleagues within each of these forced dichotomy groups to compare the data as well. This compares male and female within the Department of Psychiatry. I'm going to go to the next slide to show you the percentages instead of the count. So we have female in blue on this slide and male in orange. 46% of our female colleagues are experiencing microaggressions once or twice a year, 22% monthly, 6% weekly. So compared to the male colleagues, it's consistently a microaggression being experienced more often. The question then asks about, we're all over the health system, and so the capacity to interact with people is not just with our department. And so the next part of the microaggression question was to look at, compared to those who might be within our enterprise at HSC or UNM, but aren't part of our department specifically. And so when we look at these numbers, we can see that our learners are experiencing more of their microaggressions from individuals outside of our department. And our learners often are embedded within a lot of our hospital systems, much more so than our faculty and staff might be. And so that could be an explanation for that. When we look at the breakup between white and the non-white comparison group, compared to being exposed to a microaggression from somebody outside of our department, but within the HSC system, we still have the same sort of situation that we saw on the previous one within the department, that our Caucasian colleagues are experiencing once or twice a year a microaggression from someone outside of the department, but our non-white are experiencing a higher percentage monthly as well as weekly. And then when we look at the male versus female, our female are experiencing 50% of the females who completed the survey once or twice a year, similar monthly, and slightly more males experiencing a microaggression from someone outside the department weekly within our institution. The next question on the survey is a way for folks to rank order priorities. So there was an opportunity to select from a variety of options that you'll see on the next slide. Which one do you feel like our department should focus on? When knowing that we can't focus on all of them at once, but certainly need to focus on many aspects of diversity, equity, inclusion, not exclusively race or ethnicity or gender. There are plenty of other ways that we can improve as an institution. When you look at the votes, the number, this gives you a breakdown of which categories received the most #1 votes. And so the categories are down here at the bottom: ageism, disability, gender, all the way through to veterans. And so you can see that the categories, the top 3 categories for the most, for first priority for our department was race and ethnicity equity. Next would be implicit bias, and then gender equity was third. When you look at the second priority, what had the most votes, implicit bias is popping up as number one, immigration and immigrant groups, and socioeconomic and microaggressions are sort of a three-way tie there. And then gender equity coming in third again. And a third priority, it's after this third priority, it's the graphs start to look a little bit more like this, with some uncertainty and different, more similarity among the bars, but we still are seeing race and ethnicity very high. LGBTQIA positive is coming in on this survey as a third priority, followed by socioeconomic, immigration and immigrant groups, and gender equity. And disability focus. Sorry, your guys' pictures were blocking that one. So we get a little bit of a sense of race and ethnicity, gender, in particular, and implicit bias from the previous slides being a focus. But by and large, race and ethnicity comes through on each of the priorities as something that those who completed the survey of being an important thing to address, perhaps in the first round of looking at DEI in our department. This is just an alternative way to think of the data. Everybody in the survey was able to provide 3 words that they would describe with regards to DEI, and then it gets entered into a little Wordle thing and created this picture here. Just a nice way to think outside of the box of our data. So if you've ever done a Wordle, and words that are most repeated become bigger, and the words that are least repeated stay on there but become smaller. So among all the respondents, the words that rose to the top among multiple respondents were diverse and open-minded, welcoming, supportive, fair, willing, trying, equitable. So by and large, a large amount of kind of qualitatively positive oriented words with regards to our efforts for DEI within our department. So what are we going to do with this data? How can we use this to move forward? And what are we doing at the same time as trying to figure out what to do to move forward? So one of the first things that we did last year was this planning survey, and that's what we get an early introduction to today, knowing that there is much more within that for us to look at. I wanted to also highlight that we have an institutional implicit bias training policy. While we have had implicit bias training required for searches, for faculty searches primarily, it's never been an official policy. And so in the past year, it is actually a policy requirement for any individual who serves on a faculty or staff search committee is required to have annual implicit bias training. It's not the only way, the answer to understanding bias in searches. Training is just the first part. The next part becomes the actual conversations and awareness of implicit bias that we might have within our search. The reason why this is important, if we're looking at DEI and understanding the role of improving our recruitment and retention and outreach of diverse individuals, understanding and recognizing bias is a key component of making that a reality. I'm not sure if Dr. Haynes is on today because I can only see a couple pictures. We're looking at more formalization of a DEI curriculum within the residency training program, collaboration with Dr. Kanaka. There's already components of cultural elements within the curriculum, but with a group of residents, we are going to look at some other additional ways to add on to that with a DEI focus. The last one is on this slide is a new project that will be rolled out sometime in the next few months. I applied for and received a SEEK grant. These are internal SEEK grants. I cannot remember what it stands for, but something around education and allocation committees. So somebody can put it in the chat if you can remember. My intent with writing this was to bring in the aspects of mentoring that I've heard through many of our faculty meetings, as well as just conversations of the importance of improving that within our institution as a whole, but thinking at a level of our department, but also combining that with how important mentoring is with regards to diversity, equity, inclusion, and how we support those from diverse groups that we bring into our institution and provide mentoring throughout their time here. The focus of this project, more will come out about this probably through the newsletter in the next coming months, is on residents and assistant and associate faculty. But there is a component of it that involves a creation of a mentoring committee within our department that would not be for faculty only, it would be for learners and staff as well. Anticipated, what are some things that I hope we consider as a department? We'll have conversations around that might be impacted by the data that we see in today's survey. The addition of a subcommittee. So I think in my role with as a director, I cannot see the perspectives of every person within a group, and the role of a committee in sharing the development of a DEI plan is integral to making it belong to the department and not just one individual. And so the goal would be to figure out a way to create a committee that would exist in being able to inform leadership on some things related to DEI and provide recommendations. Recruitment and outreach based on, of course, the first slides that we saw with faculty and looking hopefully then at staff and considering our recruitment of residents and interns and fellows is an important component in diversifying how we approach and bring perspectives into our conversations. It's hard to have those conversations and create an action plan if there's voices missing. And in order for those voices to be present, we need to recruit and provide outreach and retain those voices within our department. And so being able to think creatively and innovatively about how do we improve our recruitment strategies and then create a pipeline that is more diverse than we might have access to now. And the last piece here on this one is there's a larger conversation around how do we formalize DEI tracking a little bit better as an institution. And one area that has been brought up in a couple conversations is the use of DEI goals within annual reviews and performance reviews with a commitment from all of us at an individual level, working in how it might fit with our own roles and responsibilities, which will be different for each of us, but ensuring that we all have a shared responsibility in creating a diverse and equitable environment. And one area, just feeding on what Josh had mentioned at our faculty meeting, that they have been looking at a way to track this for faculty is through the digital measures mechanism. So what to do next? These are the last couple of slides. How can we do this? Just a few takeaways for us to think about as we go into conversation, and then just future conversation. Representative leadership and how important it is for diverse perspectives to be present at meetings and conversations and decisions. That could be race, ethnicity, gender, sexual orientation, power status within faculty, staff, and learner. And it's also important for us to recognize that, that we need to encourage and provide space for voices that might be pushing against the status quo, and to be able to hear those voices that we may not always agree with. And looking at how we lead these conversations, some practical things, thinking about how we introduce each other and ourselves in Zooms or in meeting situations, resisting how we generalize amongst ourselves, and then openly asking for opposing views and suggestions to avoid the capacity to only hear those who seem to share our own views. Some questions that we can ask ourselves, or that our leaders can ask themselves, or that our institution can continue, is what are our actual values? We have some mission and value statements as an institution, but I think it's important for our department to consider more specifically what our values might be as they relate to psychiatry and behavioral sciences. Who's going to benefit from our existing structures, who's not benefiting from them, and how do we make those more equitable? Who have we shut out in either accidentally or intentionally by those structures, and how do we address that? and looking at equitability with regards to processes, guidelines, and policies that we have. It's easy to get into the mindset of that things have always been done certain ways, but that's oftentimes where we lose track of the inequitableness of certain systems. And I think with that is the end of my formal talk. And stop my share and open it up for questions, comments, conversation for the about 5 or 6 minutes that we have left.
Let me start, Dr. Smart. First, to thank you for your presentation. And I guess I could summarize that we got a lot of work to do. I must say that I was surprised. I thought our numbers were going to be better. Certainly there's room for improvement. And I don't even want to say, well, how do we compare with other departments or with society at large? That, of course it matters, but really it should be zero in terms of microaggressions and so on. So we got a lot of work to do. And let me emphasize that it is a priority for the department. We have certainly room for improvement, and we'll do what we can. So count on our support, Dr. Smart. I must say I'm a little surprised and a little upset. I thought our numbers were going to be better. So thanks for, I guess, enlightening me in terms of an issue that we certainly have. I'm going to stop there and let others to make comments or questions. And back to you, Dr. Smart.
Yeah, thank you. I appreciate your comments. It's important to hear that from the leader of the department, so thank you. Dawn's got her hand raised. I saw it. I saw the hand raised.
My virtual hand. I was really surprised by these graphs that you presented, sort of a snapshot in the faculty meeting. And I had to sit with after that thinking, if I wasn't a cis white woman, I probably wouldn't have needed a graph to be surprised. So I'll say that first. So I had a couple of thoughts. Some of them aren't well-formulated questions, but I do have a question. You talked about trainings and whatnot, but I'm wondering if there are any, are we looking at any funded initiatives? I mean, I think there are national agencies and consortia that really look at looking at the recruitment, hiring process, retention, and mitigating bias in faculty searches. So I'm curious about that. I had been reading a little bit after the faculty meeting about grad students going into academia and faculty positions and reporting disconnect with personal value as opposed to the structural dynamics of higher academia. And so I was kind of curious about that as well. But I wonder, you've taken some data over years, and I wonder, have we looked at data in regard to retention for white faculty versus faculty persons of color, and how long someone is with the university, depending on maybe those factors? Because I've read a couple of times, things are changing and faculty is becoming more diverse in lots of institutions, but ultimately, if we're not retaining people of color, then we're not going to make a substantive gain in representation. So I'm kind of curious too about retention just in general, and the disconnect possibly between white faculty and people of color.
Mm-hmm. Yeah, we can look at the data. We do have level of status over year between assistant, associate, and professor. And so I think that there is a way to look at some of those trends over time. Trainings, I think, are an important component. And I'm thinking when we convene the committee that looks at this, really trying to figure out which types of trainings might be important to start with. Some of those could be provided internal, which would be more FTE and time-focused resources, but some would be more of a financial commitment and thinking through those. And so, I think that sometimes the trainings are become seen as an answer. And sometimes I think we want to make sure we build the trainings around long-term intentionality, so that folks get access to accurate information and skills, but then it is carried forward in some way to be beneficial. So I think that there are definitely a couple of the allyship and some more explicit implicit bias trainings that are available. I think I'm missing one third thing that you asked about. Personal versus professional and retention. Yeah, so pipeline and components of that. And I think understanding for like residency and like looking at that component all the way through to what might make somebody want to stay or decide to leave. And there's always plenty of factors in considering that. And I think looking at our a successful pipeline does look at from residency or from internship or from whatever level they might be entering our department through to being retained. Thank you for those. I wrote down the general gist of what you said though, so make sure I capture those in more thinking. Paul, I see your hand raised.
Great presentation. Do you think the more polarized climate of the nation had any impact on the data you presented?
The more polarized climate last year, you mean?
Yeah, of the past, yeah, especially over the last presidency.
I don't know. I mean, if we had the survey done before that, and then we're able to look at the numbers, I guess I could say more accurately whether or not, but it could just be that that's what regardless of the polarity, and having an opportunity to finally perhaps voice what they've been feeling qualitatively is just a representation of what it has perhaps always been or what it felt like. But it's a good question, but now we have a baseline and we can see it moving forward and map that against any kind of event, cultural or stressful events that we're experiencing.
To that point, Dr. Smart, this type of survey, of course, if it's just one, there's not much use. And I know you're planning and do it longitudinally prospective, so we should do it at least annually and see if we're improving or not, and if we're not, what is it that we're not doing right? Thank you, Dr. Smart.
Other questions or comments?
Any comments from our residents?
You can always find me at other points, so don't feel shy to reach out around the conversation too. So. All right. 4 minutes to spare. Remember the beginning, time of question. Let's free you up. Thanks, everybody.